So really quickly, for my section, the doctors both agreed that working with a doctor previously before going into your own business has a lot of benefits, especially as a recent grad and having all the debt, but it's not necessary. Some of the pushbacks that they had is that they don't take a lot of insurances and they'd prefer you to pay cash, but they do allow you to file with your insurance yourself. They just won't do it. Also, with getting patients to do e-stim and all that kind of stuff and how that can help, they just instruct them on that. And then like a patient visit differs from which doc they see. Like Dr. McCabe does this normal, typical chiropractic exam, while Dr. Doolittle does a functional neurology exam as well. And then they both enjoy educating their patients and letting them know like what's going on in their treatment and how it's all benefiting them in the end.
Something unique about the doctors at Alpha Life is that they are traveling chiropractors. When asked about how they market themselves as traveling chiropractors, they explain that they attend small business association meetings. These meetings have allowed them to gain visibility in the working communities, as well as giving them insight on how they can make their business better. These meetings allow them to give more time than money to marketing. Their marketing budget consists of about $300 a month, which goes towards getting listings on the first page of Google, as well as a small community magazine ad. As for they wanted their practice, they wanted an office close to home and easy access from all parts of the Metroplex and airport. They wanted an office that would feel and look like a professional place with enough parking to grow into. They also wanted a conference room on the second floor to provide for those health talks and education. The type of patient they wanted was one that is engaged and concerned for improvement. Since they are multidisciplinary in the chiropractic scope, they have no other specific qualities that they are looking for in a patient. Lastly, we asked if they partner up with other businesses for their services. Subsequently, their answer was not yet. They have a vision of incorporating a lab diagnostic company so they can lend them a nurse practitioner to perform blood draws, salivary hormones, and allergy testing. If these were incorporated, they could have those hard conversations with patients with hard proof that allow them to create a new paradigm of better wellness care.
The doctors at Alpha Life were fiscally smart while still in school. They made sure not to spend too much money on extra things and were able to open up their practice after school without having to take out extra loans. Dr. Doolittle did take out a personal loan with a doctor she knew that was able to buy their equipment, but luckily this loan was interest-free. They've also stated that the only investments they've made is in themselves through the use of multiple seminars and making sure that their office has a warm and inviting environment. They saw a profit as of their second month open. During their first day open, on Valentine's Day, they ran a special. They feel that was able to get many patients in the door and understand how they work as doctors and how their office runs. They have a fixed overhead cost of about $3,000. This includes their rent, internet, etc. They have put most of their money back into their office, however, and have not actually set up a fixed salary. They are currently working with a CPA, though, to establish one.
Hi, my name is Lindsey. I did the analysis of the office flow, so we got to ask him questions about like the day-to-day functionings that they do every day. The first thing we asked him about was what does the patient do for the initial paperwork. When the patient walks in, the CA gives them the paperwork and they fill it out, and the patients are seen according to the time that they arrived. So they do appointment times, but mostly they just go off who arrives first, who gets seen first. Then we asked them about how they do their initial exam. And after they take the history, they decide what type of exam the patient needs, and from there they decide what type of imaging they want. This office uses the imaging center to send all their x-rays and get them taken back for the doctor to see. Then we asked them about how they named their business, which wasn't really a office flow question, but it was really interesting because one of the doctors was an alpha female, so they decided Alpha Life was kind of like making health the most important part of your life, which was really good. And then the daily goals for the office was just to make patients feel like they're getting taken care of and making sure that they feel like when they're in that office that they're the most important thing at that time and moment, which is a good thing. So we learned a lot about the day-to-day functionings of an office, which are very important.
So Alpha Life had a very nice approach of they started small and they are growing into their practice. Right now they don't have a chiropractic assistant. That's something I actually really like. It sounds like they are delegating the work between the two doctors. At the moment, for office flow, they aren't doing x-rays or MRIs in the office, but they do advocate patients getting imaging. That's something that is very nice too, because that cuts the overhead out of their office. Right now they're growing more services, but right now they really dialed it into what they're comfortable with. Functional neurology, gait, posture analysis, musculoskeletal adjustments, and allergy testing. That's something that they're working in, and eventually they would like to be very big in functional medicine, but it's a very hard subject to tackle, so they're doing continuing training right now.
It is difficult to suggest recommendations to a successful and growing practice as students, but after the interview with Alpha Life Chiropractic, there was a few topics that were discussed that we believe would run more efficiently, such as time of day spent with patients, are relatively low, no formal salary, few partnerships, and patient education about insurance. He said, unfortunately, since they are a fairly new practice, they do everything themselves from patient care to paperwork to marketing. As expected, this takes up much of their time, and consequently, they lose time doing what they would prefer to be doing, treating patients. A chiropractic assistant could do paperwork, make appointments, help maintain office cleanliness. The marketing agent could ensure that their practice continues to grow without them having to take away time from their patients to get new ones. An accountant could give financial advice on when they are stable enough to hire, how much salary to pay, and more.
He mentioned that they had relatively few partnerships at this time. Though this would make sense being that they're a new practice, it is recommended that they make a new priority. Not only does it help give credibility within the community, but it also is a great way to wait for new referrals. It is important to reach out to other healthcare professionals, but make sure to become involved in as many group setting events as possible. Don't try to push chiropractic into people's minds. Instead, if you participate and or support these activities, you're likely to gain great connections. They enjoy traveling to other states to help push our chiropractic profession. The problem arises, though, that they are not licensed in these other states, so they are not allowed to adjust legally. They can only educate people. We suggest that even though the continuing education and licensing process can be lengthy and difficult, that if traveling for the sake of chiropractic, it is important to the business that is worth it. If they become licensed, they can not only educate, but make more income while traveling. Lastly, he said that one of the most difficult aspects of referring to the patient, communicating, is care of insurance. They take insurance in cash, but prefer that people pay cash. Most people that have insurance want to use it, but the problem comes that insurance limits practice scope. Many times deductibles can be so high that they're almost pay the same amount, if not more, than with insurance anyways. We recommend educating the patients about this from the very beginning, even with the payment option pamphlets at the front of the office.
If the doctors are firm and not wanting to hire a marketing agent, more time needs to be delegated into getting out into the community and getting their name out there. They stated that they're part of the Small Business Association and have gotten a bunch of patients just by attending meetings and stuff, but it seems that they could be spending a lot of that marketing time in office right now when they could be spending it outside in the community. They also seem to be taking like a wait and see approach to, for example, for that lab diagnostic company. And we believe that when they have idle time, one of the doctors, they should just go out to the community and just be a little bit more active in their marketing approach. Try to hold monthly health talks, try to go to surrounding businesses and invite them to join in the conference room. On weekends, they can go to athletic events like 5Ks and marathons and aid patients that way. Offer specials like buy one, get one free visit, or run a percentage deal on your first visit. And it seems like they're more geared towards the medical community right now when they market, when they could be a lot more broader, especially being a new practice, just to get to more people. And the idea right now, being a new practice, is you want to get your name out to as many people as possible. And it seems like they're just being a little bit more conservative in their approach.
In terms of the way that the office flows at Alpha Life, I would agree that the hours are adequate, and it's good that they want to begin with having a wide spectrum of hours so that they can get a nice patient base. But in terms of giving the patient what they need to expect when they come into the office, like how long will the exam take and things like that, for millennials and people in this generation, it's important to make sure that they know how long it's going to take, what it's going to look like, and of course how much the price will be at the end. For example, that the office does a neuro consult that takes about an hour. that looks quite unattractive to most people because an hour is a lot of time. Perhaps if they should take it down to maybe 30 minutes, then that would help them get a better flow through their office.
Doctors Doolittle and McCabe run Alpha Life Chiropractic, and they're traveling chiropractors that serve the Dallas and Fort Worth Metroplex area. They are looking to incorporate some lab diagnostics into their practice to further diversify the services that they offer. It's a very young practice. They have a lot of growth potential still. There's still a lot of community outreach and awareness that they can grow into. They have not yet set a finite salary for themselves, so right now they're just kind of pulling what they can and keeping that to a minimum, which is fine for a newly started practice, but this is something that they need to change pretty shortly. And they have a fixed overhead of about $3,000 a month. They're very patient oriented, and they talk a lot about meeting patients' needs and making sure that they're scheduled and seen when they come in. We have a person in our group who is an actual patient, and she said that scheduling normally does go very well, but from time to time it can be a little difficult, so maybe it's time for them to start thinking about hiring some staff, and that'll help make sure that phones get answered and all the paperwork is done and inputted, and that allows them to focus more on patient interactions, which is where they excel. Their initial exams are a little lengthy. Maybe they can incorporate some more insurance education into their initial exams with their patient education. Just that way their patients are less confused about what actually they have to pay. They do a lot of community outreach, but some of this outreach is out of state and out of their community. If they stay in their community a little more often, maybe their growth will be happening a little bit quicker, and it's just more monetary value for them in their practice. And if they do these things, it'll allow them to just focus on the patient care and adjusting and the parts of chiropractic that will sustain them for years to come.